We'll continue with the causes of cancer. The first item is going to be the sun and the UV exposure. We have several different types of different skin cancer that results from the sun and the UV exposure. The most common type of cancer on your skin is going to be basal cell cancer, which can be removed surgically. Not all skin cancer would be easy to treat, such as melanomas, which is going to be the most serious type of skin cancer, and it can be life-threatening if it metastasizes. So if it moves to a different body part, it can cause serious problems. When you see a new unusual growth or a change in an existing mole, and you notice that things are changing a little bit, maybe in shapes or sizes, then it may be a good indication that you may have melanoma. And tanning can increase the chance to develop skin cancer because you're exposing your skin to UV light, and the stronger and the longer the exposure is going to be, the higher the chance that it's going to be for skin cancer. Another fact can be radiation exposure. Now, usually humans are not going to have large dose of radiation exposure unless you are working at a power plant and something happened, or your work has to deal with some sort of radioactive materials. But other than that, your chance of having radio exposure is low. And even if you have it from around the environment, the dosage is going to be low enough not to affect you. However, it can lead to a variety of severe and serious cancer if you're exposed to it over a long period of time with a high dosage. Also, the problem with this radiation exposure is that they're going to affect your sex cells, so they can affect your reproductive cells. So, once your reproductive cells are affected, it can cause cancer in your children as well because your genes may be genetically modified or had mutation, and that can cause your offspring to have higher chance of getting cancer. The major sources of radiation would be from three different types of sources. We have the natural sources, different diagnostic tests such as x-rays or body scans, and then we also have different human activities that would have to go through radiation, for example, airport securities or different industries using radioactive materials. Like I said, usually the dosage of radiation is going to be very trivial and small when you encounter them in nature, for example, the sun or radioactive elements that you may see. It's not going to be lying around, but you may encounter that more so, for example, in mines or different exposure sites. Diagnostic tests like x-rays and body scans are necessary, and when you go to a dentist, sometimes when they're taking x-rays of your teeth, they're going to put a little suit or a heavy vest on you so your organs can be protected from x-rays. It's to help you minimize the exposure of these radiation sources, because even though it's a small dosage, having continuous and frequent exposure can be harmful. But again, usually their dosage are going to be small and insignificant to affect you. So we looked into different sources and causes of cancer, but also in order to know if you have a cancer or not, you'll have to monitor different cancer symptoms as well. Because we have so many different forms of cancer, it's hard to say this symptom will be this cancer, because like I said, symptoms will vary depending on the types of the cancer. Usually though, when you have unexplained weight loss for 4.5 kilograms or more, roughly about 10 pounds, and you're going to feel tired even after you rest for a good amount of time. So continuing fatigue after rest. And I'm not talking about, oh, I took a nap. It's when you had a good quality rest, and if you're still tired continuously, that may be an indication. Now we also have an acronym, CAUTION, to look out for. So these are going to be different symptoms of cancer. It does not include a lot of these other rare cancer symptoms, but this would cover most of the cancer symptoms that are visible to your eyes. First, C is going to be change in bathroom habits. Basically, you're noticing that you are significantly using the bathroom less or more. It can be an indication of cancer. A is going to be a sore that does not heal. So you may have open wound or cut that you have, and it may take unusually long time for you to heal. Or it's not healing at all after a long period of time. That also can be an indication. U is for unusual bleeding or discharge from either different moles or freckles. So they should not be bleeding if it's a mole or a freckle, but if they are bleeding out of it, then it may be an indication of different types of skin cancer. And T is for thickening or a lump in the breast, mouth, or testicles. So if you have cancer, like we said, it's going to be an unusual growth and it's going to be a form of tumor. So you may feel different thickening or a lump in different body parts. I is going to be indigestion or problem swallowing. So you may feel like, oh, I can't really digest food. It's always kind of there stuck, or I have a hard time swallowing food. It may be an indication. So for O, you'll see obvious change in a wart or mole. Usually if it's a wart or mole, they should not be changing so much, but if they're increasing in sizes or shapes or colors, it may be an indication of different types of skin cancer. And N, lastly, is going to be nagging cough or hoarseness. So if you are having a cough but you don't have any symptoms of flu or cold or any respiratory system diseases, it may be an indication of different types of cancer that may develop in your respiratory system. When you have cancer, cancer diagnosis and treatment is going to be important because depending on the type of the cancer and the type of the treatment you get, you may have different treatment plans or you may have different outcomes dealing with the cancer. For cancer treatment, it really depends on these three major things. First is the type of cancer. Second is the amount of the spread or different stages that the person may be in. And the third is going to be the health of the patient. Some cancers are going to be more common, whereas some cancers are going to be more rare. I've mentioned a person with a sarcoma on his face, and it's going to be a harder case of cancer just because face would include a lot of nerves and muscles that are going to be fine-tuned. So for that person, it's going to be a harder treatment. For other people with sarcoma in different part of body may not have to go through such huge surgery even if they have tumor growing in their body parts. Also, the amount of the spread or the stages can determine different type of treatment options. If it's more contained and if it's in the earlier stage, you may be able to remove it with surgery or different not as severe or intense care. But if it's in the later stages, you may not have much option other than to have certain type of treatment, even if you don't like to have those things. The health of this patient is very important too, because if the patient is too unhealthy or weak, you may not be able to use certain type of treatment. So you'll have to count that all into your account. Now we'll look into some treatment options, and the first thing is going to be surgery. It is going to be the best way to get rid of the tumor in the earlier stage because it's not spreading into different body parts. So you don't have to open multiple different body parts to remove the tumor. Instead, you'll have to just open one part, remove it, and done. Because you're going to remove some or all of the tumor, it's going to be hard, especially for the later stages, because if you cut too much of the parts, your organs may not function properly, so you'll have to leave some of them still in there, and those tumors can grow and actually metastasize further into different organs. I think chemotherapy is the first thing that pops into your mind when we have cancer treatment. It is often used. It is not so pleasant when you use it, but it is efficient. Basically, when you see the words here, chemotherapy, you have the chemo part and the therapy part. Chemo is also used in words such as chemistry or chemical. Here, chem. So that means this is destroying cancer cells using chemicals. The downside of it is that when they are killing cancer cells, they're also killing the healthy cells. For example, when you start chemotherapy, the first thing that you'll notice is going to be losing of your body hair or body swelling. It's because the cells that are holding your hair roots are going to die off first, so they don't have enough cells to hold on to your hair, so they start falling off. And also you may have different immune response to the chemicals and your body may swell up. We looked into radiation in the previous section for the causes of cancer, but we also use radiation therapy to get rid of cancer as well. So when we use radiation, it's going to be for that specific part, and it's to either shrink or kill the tumor cells. So shrink the size of the tumor or kill off if it's small enough. You may have side effects though, because like we said, radiation exposure is not really good for your body. So after you go into radiation therapy, after you come out, you're going to experience fatigue and nausea. And again, it's going to be very hard for patients who are already going through some health conditions and already weakened body. The next one is called immunotherapy, and as you can see from the word immunotherapy, it uses the patient's immune system to recognize certain cancer and help it destroy them. So what they do is they give patients man-made immune system proteins called antibodies, and basically they're going to say, hey, these are the proteins to identify the cancer cells, go ahead and kill them. The downside of it is that it may not recognize the cancer cells to be foreign substance or pathogen, so they may just leave it there even though it's growing, and the response may not be strong enough for the different immune system or T cells or B cells to destroy cancer cells. That means they may be able to destroy some, but it's not going to be a completely effective way of destroying all the cancer cells. Some people prefer it because it's more of a natural way to deal with cancer cells instead of using chemicals or radiation, because it's using your own immune system. So this is how immunotherapy works in a nutshell. You'll have T cells, which are going to be like the policemen or the watchmen, and these are called the helper T cells. They're going to have different things like indicator. Whenever they see pathogens that are harmful to your body, they're going to activate those and have other white blood cells to come and help destroy foreign or harmful pathogens or things. What they do is the tumor cells would go to T cells and they deactivate them. So they're going to basically deactivate the alarm system, so they're not going to interfere with their growth. What immunotherapy would do is to administer different immune system or drugs that can block the tumor cells from deactivating the T cells. So once the T cells are activated, they're going to go around and say, I recognize this as a foreign substance or something harmful, let's go ahead and fight off. Hormone therapy is when you're using different medication to either help or accelerate your hormones to slow down or stop the production of cancer cells' growth hormones. It is less proactive in terms of the fighting mechanism, and it may take longer time for that matter. So if you have cancers that are either super progressive, or if you're in the later stages, you may not want to use the hormone therapy alone because it's going to take a long time for it to be effective. One type of cancer that uses hormone therapy is going to be prostate cancer. You may not want to use other types of therapy just because, for example, radiotherapy or chemotherapy, you have a high chance of causing different alteration with your reproductive cells. Cancers in general are hard to treat or difficult to treat because you have many different factors, and also you have cancer cells growing rapidly non-stop. Also, a lot of these treatment options are going to have side effects. Even after treatment, you may have a relapse, and as you have more relapses, you have a higher chance of not being able to contain the cancer cells. So it's going to be a very tough fight for the patient. The last few slides will talk about lowering your risk of cancer. A lot of them are going to be in overlapping facts actually from the last lesson when we learned about multifactorial diseases. The first one do not use tobacco. If you smoke, you should stop. Your body will have a chance to fight off carcinogens. If you don't stop and continue smoking, you're going to put yourself in a risk of having a higher chance for certain types of cancer, such as lung cancer or esophagus cancer. You should also have a balanced and healthy meal, including fruits, veggies, whole grains, and fiber. You should avoid eating fried food or food with high fatty acid or saturated fat. It is recommended to exercise at least 30 minutes a day for adults, and actually for you guys who are teenagers, your recommendation exercise time is about an hour a day. Being active really helps you to avoid different types of diseases, so I hope you're moving during this time. And also, do not drink alcohol. Again, when you use different types of substances, you're really opening more doors to have health problems and complications. Also, protect your skin from the sun. I know it's easy for us to forget about it, and I know some people would actually like to go outside and have different tans, but you should use sunscreen with an SPF of at least 15 when you're going outside to prevent any harmful UV lights entering to your skin. You can even wear hats, sunglasses, and loose fitting clothing over, even though you're going outside during this hot summer time, so you're not exposing your body to high dosage of UV light and sun. For certain types of cancer, you may also lower your risk by having different immunization for known viruses such as hepatitis B and HPV. HPV is actually known to cause cervical cancer for females, so it can prevent it if you have the immunization. Try to avoid risky behaviors that might cause different injuries and different exposure to things like radioactive materials, and also take advantage of tests that can help identify possible cancers during routine medical checkups. You may not really have routine medical checkups when you're young, but as you grow older, they recommend you to get checks every year or every other year just to make sure if you have any harmful things growing in your body. If you have a family history of certain cancer like breast cancer or ovarian cancer, you may want to start checking up after 25 years old so that you are preventing any possible growth in earlier stages. Now for this lesson, instead of giving you the questions at the end of the lesson, I am having you answer the 5 objective questions that you have at the very beginning of this lesson. So either you can go and look at your objective questions that you wrote down, or look at the slides again and answer them.